hit record before I forget. Okay, Melissa, take it away. I will keep this, just let me know when you want to advance the slide.
Okay, sounds great. We are live. Okay, welcome everyone. Welcome to the 5th annual Skirboll Family Autism Conference. This evening is the first of 6 sessions we'll be holding over the next 3 days. Presentations will kick off again tomorrow morning and then again on Saturday morning. We're excited for this year's presentations and our expert presenters. So we'll look forward to seeing you over the next 3 days. Now it's my pleasure to introduce Susan. Oh, I'm sorry, Valerie. I'm not doing my own slides here. So before we get started, just some housekeeping announcements. There is live Spanish interpretation. You can get Spanish interpretation by clicking live interpretation at the bottom of your screen. There's a little it looks like a little world that says interpretation. There is also captioning. I know I can see the captioning right now, but if for some reason you can't, you can push the closed captioning button. We also have ASL interpretation. They have been spotlighted. So if you would like to be able to see everybody, you can go back to gallery view and you'll be able to see everybody, all of the panelists that have video. If you just want to see ASL, you go to the, you can go back to the other view. Presentations and materials are available on the Skirboll website, and the link is right on the, you can see the link on the screen, and I'll put it in the chat box as well. A lot of the resources and things can be found under speakers and sessions under each individual session, as well as things like the Family Navigator room and their research link. Attendees videos are off and attendees are muted automatically. But if you have questions for our presenters, please feel free to put them in the Q&A box. Chat stuff will just come to us. So we use chat for housekeeping questions or those types of things. And at the end of the conference, you guys will receive an email with a link to an evaluation and a certificate of attendance. So we really value your feedback. And then with that, I will introduce Susan Hyman. Dr. Hyman is the professor and chief of the Division of Developmental and Behavioral Pediatrics at Golisano Children's Hospital. She is an internationally renowned expert in autism spectrum disorders and intellectual and developmental disabilities, although she probably doesn't want me bragging about her. We love to brag about her. Dr. Hyman has participated in numerous research initiatives, collaborative projects, and organizations. Please join me in welcoming Susan Hyman.
So thank you, Melissa, and you're right, it is embarrassing. My role here is to welcome all of you. Thank you so much for joining us virtually. I'm sorry that we're not all together because it's so exciting to see the outpouring of interest and support for families and providers who serve children with autism in the Rochester area. Some of you have heard me say this before, but it was about 10 years ago. I was sitting in Washington with one of our family advisory committee members at a national meeting and had just finished talking about some research that we had been doing here in Rochester with my colleague, Tristram Smith, who many of you know, and we have a debt of gratitude for him on so many levels, which we had completed looking at some behavioral interventions here in Rochester. And this parent leaned across the table and smacked me and said, "How come you didn't tell us that you were doing this?" And we realized at that point that we really do need to make certain that all of you that all of the families and all of the providers here in Rochester know what the cutting edge research in autism is, know what the current policies and best practices are, so that you can most effectively advocate and make choices for your children. So this is our 9th annual conference, the 4th that's sponsored through the generosity of the Skirboll family. And really what I want to do is welcome you all to this conference, ask for your feedback so that we can make our care better and that we can study things that are of interest to you, that will make it easier and more productive to help your children. And I also want to thank the Skirboll family. They have really stepped to the plate to really help families on so many levels deal with behavioral health struggles, and really through their generosity have allowed us to continue to provide this annual conference. So I want to thank them. I want to thank Bunny Skirboll, Mrs. Skirboll, who can't be with us this year. She's in Florida. And what we'd like to do is to play for all of you a video of one of the Skirboll family members before entering the first conference room, where my colleagues will be talking about what to do after an initial diagnosis. And for some of you, this is a recent memory. For others of you, it's a long distant memory, but it's a memory nobody forgets. And no matter how many times Brenna and Lisa and I are involved with it, now however long it's been for Kelly, it's something that's with you every day. So on that note, let me turn this back to Valerie to introduce Ryan Axelrod.
Thanks so much, Susan. Folks, I'm just going to hit play here for us.
Hi, everyone. My name is Ryan Axelrod, and I am the granddaughter of Bunny and Mort Skirboll. This conference is so important to me because I am currently a special education teacher. This conference was also so important to my grandfather, and I know that he would be so happy to see that although we can't all be together in person today, that we are still able to have this conference over Zoom. My grandfather was always so proud of my work in the special education field, and we loved being able to share new things that we had learned in the conferences with each other. The information and resources provided to families, educators, and other professionals in the field are so valuable and can really make a positive impact on the way that we can best support children with autism. I hope you all enjoy this year's conference and leave with new information. Thank you so much for being here and supporting the Skirboll Family Autism Conference.
Great. All right, thank you again, everybody. I'm just going to switch over to a new screen for us and introduce our panelists for today's session. Sorry, one more time. There we go. Just making sure everyone's spotlighted for us. Thanks, everybody, for your patience with technology. All right. All right, here we go. Thank you again, everybody. I'd like to welcome everyone to today's session, Navigating Next Steps Following an Autism Spectrum Disorder Diagnosis. On behalf of our planning committee and presenters, thank you for joining us on this chilly afternoon. My name is Valerie Smith, and I have the distinct pleasure of moderating today's session. So today we'll include a panel of speakers who will kindly be answering a variety of questions submitted by attendees during registration. So thank you to all of you for submitting your questions upon registering. You may also ask questions live by typing them in the Q&A box at the bottom of your screen. And I'd actually like to begin our conversation today by asking each of our panelists, Lisa, Kelly, and Brenna, to tell us a bit about themselves. So Lisa, would you mind starting us off?
Sure. So I am Lisa Luxemberg. I'm a social worker at Developmental and Behavior Pediatrics. I have been in the clinic for about 8 years now. And I've been a social worker for much longer than that.
Thanks, Lisa. How about Kelly?
Hi, my name is Kelly Manigault. I'm a parent of a son with autism. He was first diagnosed through the school when he just hit 3 years of age. So I'm born and raised in Rochester, but I had relocated to Houston, got married, had kids, and then came back to Rochester just because of the services for kids that are on the spectrum.
Thanks, Kelly. And Brenna.
Hi, everyone. So glad to be here. My name is Brenna Cavanaugh. I am a clinical psychologist and a board certified behavior analyst within the Division of Developmental and Behavioral Pediatrics at the University of Rochester. In our division, I do some work providing diagnostic assessments for individuals with suspected autism spectrum disorder. And I also do a bit of work in our behavioral treatment programs, our parent training clinic, and then our behavioral intervention program for children. And I also do a little bit of work consulting in the community as well. Thanks so much.
Thanks, Brenna. Okay. So real quick, before we get into our next question, I'd like to just remind everyone and mention that our discussion today is intended to share general tips and resources that doesn't constitute medical advice, and it's not specific to any one individual or child. So we'd also like to get a sense of who is on today's call. So I am going to stop share for a moment and conduct a quick poll. Click launch. And just take a moment to select all of them, that any of these, one or more, that indicate your role. Take another few seconds. We have just about everyone. I'm going to end that and share our results. All right, so speakers, we have about 2% self-advocates joining us. 52% are parents or family members. 44% are professionals who work with folks with autism spectrum disorder or a related disability. 10% are students and 2% other. Thank you, everybody. All right, let me get back to our PowerPoint. Okay. So our first question, we will turn to Kelly. Kelly, would you mind telling us a little bit about how families can best prepare for an evaluation, a visit, or a meeting with a provider? Perhaps somebody scheduled an initial evaluation. They're suspecting maybe autism or a disability. What could you share with us of how someone can best prepare for that visit?
The one thing that I've done before in the past, and sometimes I still do, is any kind of observations that you see going on with your child is to pretty much jot it down. Any concerns or questions, I would just recommend writing it down and taking it with you. It's also best to, if you can, bring a friend or a family member with you, especially if you're going to the school and getting a diagnosis or a medical diagnosis. The reason being is sometimes some of the stuff that they might be saying might go past your head because you're just caught off guard with the diagnosis. So it's always best just to have a second set of ears to listen to everything that's being said, just in case something slips by you. Also for the family, sometimes it's hard for certain family members to actually realize that there's something else going on. So it's best if you have that person's family member with you, it kind of helps break the ice so they can be like, hey, yeah, this is what's going on. And yeah, this is what we're seeing. And this is what the doctor or the psychologist is stating.
Thanks so much, Kelly.
I was also going to add too, I think that I always tell people, take videos too of your kids. It's kind of like when you take your car to the mechanic and, it's not doing the thing that it's been doing. In those sessions, we don't always get to see everything that's going on at home. And so it is really helpful when parents bring videos to those appointments and show us some of those examples of maybe challenges that they're running into or things that they're seeing.
Thanks so much, Brenna. That's a great segue into our next question. And Brenna, you might start us off in terms of what does an evaluation actually consist of? What information is needed? What's used to make a diagnosis?
Yeah, so, we did get some of these questions in from you all. And so we thought it would be nice to kind of take a step back and share with you some more information about what even an evaluation is and what we're doing and what we're looking for during an autism evaluation. So I'm going to kind of take the lead on answering some of these questions, since that's something that I do in clinic. When we're trying to determine whether a child meets criteria for autism spectrum disorder, really we want to gather information from multiple different informants, and we really want to get a good idea too on what this child's developmental history has been. So, what did they look like when they were younger, and kind of how has that progressed and changed over time, and what do they look like now? So we definitely want to gather information from parents and schools and other providers that the child might be involved with as well. It's also, can you go? Thank you. It's also really helpful. And again, I'm speaking a lot to my experience and kind of what I do and what I know our providers do. This can certainly vary from provider to provider. But often we'll also want to have an understanding of the individual's cognitive skills as well as their adaptive skills. So we want to have kind of a good developmental picture of the individual before we go into the testing, so we can adapt, our expectations accordingly. A lot of times we'll ask parents and caregivers to complete screening measures, so just different kinds of like checklists and rating scales to give us information. And then, a big portion of the assessment is really the direct observation that the clinician is doing of the child. And I do want to say adult too. I feel like we're going to talk about kids and parents a lot in this because we're pediatrics. But, you can receive a diagnosis of autism or go for an autism eval at any age. So it's not just children that are going through this process, it's adults as well. But I think I always tend to talk about kids and parents because that's just what I do. And I think that's probably the same with Lisa and Kelly as well, being a mom. So the clinician's going to do a lot of direct observation of the child. And part of that direct observation as well might be administration of some sort of standardized autism assessment by the clinician that you're going to. One that we use a lot and is kind of the gold standard for autism evaluation is called the ADOS, or the Autism Diagnostic Observation Schedule. This is kind of a structured play and conversation-based assessment where the clinician is doing different tasks. And if you've seen one of these before, you might think it looks like we're just like playing and talking with your kid, but we're really setting up these different opportunities and interactions with your child to really see if we can try to elicit some of those traits of autism and see, maybe where your child is having challenges and where their strengths are as well. And then based off of that ADOS, we often will take the behaviors that we saw and we kind of do this coding for it and we score it. And you do end up with a score from that assessment. So it looks a lot like play and a lot of kids really like it. But we're also doing a lot of kind of standardized interactions with them during that. And you can slides. So, the clinician is trying to gather all of this information all together to determine whether the individual meets diagnostic criteria for autism spectrum disorder. I would say most everybody, you and I probably exhibit some signs and symptoms that are consistent with autism spectrum disorder, but it's really about meeting the full criteria for an autism spectrum disorder. So that full criteria, I have like a little visual here, consists of that you're looking for a child to display all three of those deficits that are indicated in that area of social communication, and then at least two types of restricted or repetitive patterns of behavior and interest. And the clinician is also making sure that these things are pervasive, meaning they're not just happening in this setting. It's something that happens in lots of different settings and has been happening in lots of different settings, and that we can account for some of these differences by something else, some other diagnosis or just situation, for example. So it's really taking all that information together and making sure that a child meets all of the criteria for autism spectrum disorder that kind of determines that diagnosis.
Wonderful. Thanks so much, Brenna. So next we'll move into what are some of the first signs that somebody might see in autism?
Yeah, and I'll go ahead and I can answer this, but Lisa, Kelly, feel free to chime in as well. It is very hard to identify and diagnose autism in babies and really young children. So usually before the age of 18 months, we're just not that good at doing that. Sometimes parents will receive a diagnosis and then they can recall back and they can remember things that they saw and perhaps their infant or before they were 18 months that might have been like those first indicators. But really, even the most trained professional can't look at those babies and can't notice those differences. So some things that parents do recall noticing, they might have noticed that maybe their child just wasn't smiling at them a lot, didn't have a lot of those social smiles where like if a parent goes up and gives them a big smile that they didn't necessarily reciprocate that and smile back at them. They might have noticed that there was less kind of that back and forth, like cooing with each other and babbling and smiling and making those expressions. So, some of those deficits in that reciprocity or that kind of back and forth interaction between them and their baby or small child, they might notice that. They might notice limited eye contact. They might notice that their child's not using simple and basic gestures. So starting to wave hello and goodbye to people, pointing at things that they want or to draw your attention to things. And they might notice as well that their child wasn't responding to their name. There are screening tools that pediatricians typically will give these at your well child visits to screen for autism in young children. But if you're concerned, you can certainly find these same screening tools online too.
One of the things that I often hear from families is about sensory issues. And so the EI, the early intervention person, may mention that, and that may be a flag for them for autism because it's one of the diagnostic criteria. But I always like to remind families that kids can have language delays or sensory issues without autism being the diagnosis as well.
One thing, if I'm able to chime in, is that I noticed that with my son at an early age, like especially in between about 18 months to 24 months, he would say like a couple words, like maybe one or two words, never combined though. So it was only like one word thing. But sometimes he would go sometimes all day without saying anything. And I do remember one very key memory I had was there was one day where he would not eat anything except for Reese's Pieces peanut butter cereal. And he wouldn't eat nothing else. I remember taking him to the store and he was wanting it, pointing towards it, like leaning towards it. And I was like, no, I'm not getting this because you need to eat something else. And it was just complete meltdown. So I do know, now that I think about things, he also had like some kind of taste texture issue going on there. Or at the age of 2 is when he started speech therapy, because we found out he wasn't meeting the milestones for speech. And he just would be all over the room, all over the lobby inside of speech therapy. It seemed like the more people that were in that lobby, the more hyped up he would get, and just complete screaming when the speech therapist would take him back there, or when they do the feeding therapy with him. So.
Thank you, everybody. Wonderful. Our next question. So upon receiving a diagnosis, perhaps a parent is told that your child is on the autism spectrum. The first question might be like, where is my child on the spectrum? So Brenna, I'll turn to you for our to start us off.
Yeah, so we definitely wanted to include a few of those questions that I think we often get as a first and initial response or question to receiving a diagnosis of autism. And I know this is a question that I've gotten a lot, and I understand it. I would probably ask the same thing too. It's such a broad spectrum, and we all know that now. So where is my child on the spectrum? Like, what does this really mean for them? And you in the audience who have received a diagnosis of autism might have asked your clinician this yourself. And I always feel bad because I don't feel like I can give a straight answer for this question. And so if you didn't get a straight answer when you asked that question, I kind of want to explain why maybe you didn't get a straight answer for that. And it's not because your provider doesn't want to tell you something. It's just that this is really a hard question to answer. There are so many different features of autism, so many different traits and symptoms of autism. And it's really hard to pick like one spot on the spectrum where a child or an individual may fall, because perhaps they are doing really, really well in one area, and then they're having a lot of challenges in this area. And then let's say they have like no repetitive behaviors here, but they're super rigid when it comes to changes in their routine. And so you see there's a bunch of scatter now across all of these different traits of autism. And so when you ask, well, where is my child on the spectrum? It's really hard to take into account, well, they're here for this, and they're here for this, and they need a lot of support here, but they probably don't need any support here. So it's hard to sometimes give that kind of straight answer for that question. So, I think a better way to approach this sometimes is, where are my child's strengths and where perhaps are their areas of need.
So similarly, what are some of those traits that you mentioned that you see maybe initially with a diagnosis? What might those look like as somebody ages, as they get older?
Yeah, I'm going to give a similar answer to this one, and that it's so hard to answer this question. I wish we could answer this better. And I do see this as a question that I get asked a lot. I think people's wheels start spinning, and their first response is sometimes, well, what's this going to look like later on? What's my child going to be able and capable to do? And especially when we're diagnosing 2- and 3-year-olds, this is really an impossible question to answer. We actually are just very bad at predicting that trajectory for kids. We cannot seem to pinpoint things that indicate, growth and challenge when they're that young. So, we do know a few things that can help a child to grow and develop over time. And, of course, this isn't always the case either, but we do know that a child being in a loving and supportive home and family certainly has good prognostic indicators for that child. If a child is developing some language in earlier years, we know that that can be a good indicator for them. If we know that the child's just general kind of like development and their cognitive skills are where they should be, that can be a good predictor. And if the child is receiving early intervention, that's always a good thing. That's going to help. And especially if you see that your child is responding to early intervention, that can be a really good predictor too. If they're responding now, that means they're probably going to continue to respond to that early intervention. But I do have to say, when a kid walks in at 2 and 3 years old, sometimes it is shocking when you see that kid, even 5 years later, and they just don't look like the same kid anymore. So we're really bad at telling sometimes.
Yeah, and knowing that, what might you say to a parent if they ask, what are will my child grow out of their autism? What might you suggest?
Yeah, this is another, I think, challenging question that we do get presented with sometimes when giving that initial diagnosis. I would say typically, no. Typically, autism diagnosis is a lifelong. Traits of autism can certainly vary throughout the lifetime. But most individuals will continue to meet diagnostic criteria for autism and continue to identify with autism. However, there are about 10% of individuals, the research suggests, that will drop that diagnosis in their lifetime. So what that means is that, when they were this age, they might have gone to a provider who gave them a diagnosis of autism, who said, I think they meet criteria for autism. And then maybe a little later on, they go either back to that same provider or another provider who says, I don't think that they meet criteria for autism anymore. Part of this could be that there is always a level of subjectivity to a diagnosis. Sometimes it's not super clear cut, and sometimes a clinician is making a judgment call on that diagnosis of autism. Other times it is because a child has truly, gained and acquired skills. And some of those features that we were seeing when they were younger, we're just not seeing them anymore, and they don't meet criteria. It doesn't necessarily mean that, they now become neurotypical. So there might still be some differences, but about 10% we know from the research do drop that diagnosis at some point.
Great. Thank you. Brenna, this next question you might want to start us off with, but please, Lisa and Kelly, feel free to share too. What's the difference between a medical diagnosis and an educational classification?
Yeah, so a medical diagnosis is something that you're going to receive from a licensed provider, typically not associated with the school. So this is going to be a doctor's office, a clinic. It might be your developmental pediatrician. It might be a psychologist that you go and see. So that is a medical diagnosis. An educational diagnosis or classification, at least in New York State, is simply a classification on a child's individualized education plan or IEP that qualifies them for special education services within the school. So it's important to know that these two things are not dependent on one another. So just because a child receives a medical diagnosis through like a doctor or a psychologist doesn't necessarily mean that they'll be classified in school with that classification of autism. That's something that you in the school have to determine to be appropriate. And vice versa, your child can be classified as having an IEP under autism without actually having a diagnosis of autism. So schools can just put that classification on your child's IEP because they believe your child will benefit from those supports that typically accompany that classification, even if you don't have that diagnosis. I don't see that a lot, but it can happen.
Some of the other educational classifications, just so that people are aware, are like a motor impairment, multiple disabilities, an intellectual or learning disability, and vision and deafness as well. So, and then there's a category sort of other health impaired that things fall under as well. And then traumatic brain injury is sort of the other big one if somebody has been born with a brain injury or develops one through an accident over time. So, but the schools work on the IEP, not the medical practices.
I was going to add something, and just from my own personal experience, my youngest was diagnosed through first through the school, and then received his medical diagnosis that I had to actually push for. But it seemed like once he got the medical diagnosis, everything, the doors started opening up. He was getting the therapy that he needed. It was through private therapy, though. I felt like we got more information on his diet, on him being autistic. He was referred to gastro because he was having issues, and also to an eye doctor. And also, I would recommend, if it's something where the school is giving you a hard time about possibly seeing if they qualify for an IEP or special education, or even a BID, which is a behavioral intervention plan, then I would also recommend going to your child's doctor if they have that medical diagnosis, and get documents stating that the doctor stating, hey, they need an IEP. And that's just, that other part of experience is from me having an oldest with ADHD, which I had to do because the school wasn't going to do an IEP. They were trying to wait until after a couple months of him being on a medication. So I feel like it kind of works in hand. Just, that's just my own personal experience. It's just, I think it's better sometimes if you get the school diagnosis and the medical diagnosis, because it's like things start opening up. And then I notice up here, the providers seem to have more communication with the teachers and with the schools, from what I've seen, where whenever I notice something's going on with my youngest that has ASD, I could send a text to his developmental pediatrician, and then she'll be like, okay, well, tell the school to test him for this. Like just recently, she's like, tell him that they need to test him for a learning disability. So I feel like when you have both, I feel like it works more like together, I think.
I did notice the question too, that can a pediatrician diagnose, or just a developmental pediatrician or psychologist? And I think that's a really good question. To give a diagnosis, some primary care doctors will give a preliminary diagnosis, but most schools and services prefer if there is a CARS or an ADOS done, but that may take some time. So really, to talk to your pediatrician, because they are the primary care doctor, they're the one responsible for your child, is always a good thing. So whether you have a formal diagnosis from a developmental practice or not, or you have concerns about your child and the school district may be pushing back on some supports that you feel they need, your pediatrician is always a good go-to person to go to and let them know what your concerns are for your child, the other specialists that are involved with your child, because they're the ones managing your child and they want to know all about the whole child and who's involved with them.
And I don't know if I'm able to add in, but my experience was I also received the preliminary diagnosis for my youngest son. And that's one thing, if there's any providers listening in, I feel that that's so important, is to push for the actual diagnosis from the developmental pediatrician. I had to actually push his doctor to write a referral when we were in Texas to the Autism Center, even though he's like, well, it's going to be a 1-year wait. I'd rather wait and make sure that my child is getting everything that he needs than for him just to have just a diagnosis, but not the proper medical support. So I think that that's like very, very important.
Thank you so much. Some of you actually mentioned a few of these already. but I'll pause in case there's anything we'd like to add of how that partnership between school and providers can support a family in obtaining a diagnosis. And what might you share if there was resistance?
Yeah, so I think one of the questions was about, if somebody is resistant to going and getting that diagnosis, and that is a challenging spot to be in when you're trying to urge and support somebody to go and get that assessment and that diagnosis, but they're just not ready, or maybe they're still accepting that their child has differences, or even in a little bit of denial. I do kind of take this stance that it really is a personal decision for everybody. In a lot of cases, a diagnosis can have little practical implications, really. So a lot of times the support that you're hoping a child to get with that diagnosis, there might be ways for them to still get that support even if they don't have a diagnosis. So for example, school support, that's always one of the biggest thing that people want with a diagnosis of autism is more support in school and more therapies. But really, your child doesn't need a diagnosis of autism to be classified for an IEP and to get those therapy supports. They just need evidence that they need those therapy supports and that they have differences. So, my first advice would be for other providers and educators would be to figure out, is there a way that we can still get this child the support that they need, regardless of the diagnosis that they have? And there might very well be ways to do that. And just kind of approaching a parent or caregiver who is maybe having reservations about going to get that diagnosis or talk to their doctor. I think it's always best just to take time to listen. You just really have to explore what their feelings are, maybe what their perceptions are of autism, and do that in a supportive and non-judgmental way. You can certainly help them to weigh the pros and cons of going and talking to their doctor and getting their diagnosis. What are they afraid of? What might be the benefits of that? You can try to educate them on the benefits if you are feeling like there would be clear benefits for this child to receive that diagnosis. But certainly continue to empathize with the fears and concerns that parent has. That's usually what I find to be the best approach.
Thank you. I'm checking our Q&A too, and we have a few relevant questions to this topic. So if a family has pursued early intervention and the kiddo is now in the school system and they do have an autism diagnosis from their provider, would you encourage the family to get the diagnosis with the school too for that classification?
Not all schools will diagnose autism.
Okay.
So by giving the school special ed committee the documentation from the developmental pediatrician that your child's been diagnosed with autism, that should be enough for them to recognize autism as a diagnosis that your child has.
Perfect. Thanks, Lisa. And who is it typically in the school who diagnoses them at school?
So I don't know about like the diagnosing per se. I guess when it comes to the, because I don't think they do like an actual diagnosis, but with the classification, I think that would be up to whoever the CSE chair is in your school and the CSE team for determining that. And school psychologists can certainly be a help. A lot of times school psychologists do function as the CSE chair. Sometimes they don't, but the school psychologist can certainly be of help there.
Great.
Yeah, if you have questions, I would say go to the school psychologist and CSE, Committee on Special Education, or Committee on Preschool Education if your child's 3 to 5, to ask. Let them know what your concerns are, what you're hoping to get from the school, and then pursue what options are available to you.
Terrific. Thank you both. And one more, and then we'll continue through our slides. In terms of obtaining a medical diagnosis, is a developmental pediatrician the only person that could do that, or are there other medical providers credentialed to identify and diagnose autism?
Yeah, there are other providers who can do that. So I'm a clinical psychologist and I provide autism diagnoses. So a lot of times psychologists will be the other type of provider who can diagnose autism. And really, you know, but I don't want to say like all psychologists can diagnose autism. That's really something that usually a psychologist will have to have a lot of specialized training to do. And so not just anyone is probably going to be able to see your kid to diagnose autism. You really have to make sure that the psychologist or the medical provider you're going to is somebody who does diagnose autism and offers that as a service.
Great. Thank you so much. All right, our next question is for Kelly. Kelly, what information would you suggest a family shares with their child's school? And some of these we touched on, but feel free to elaborate.
Yeah. Once again, if they're going in for an assessment, any kind of observations that you see your kid doing, doctor's notes, stuff from the doctor. If they've already gotten the medical diagnosis, the one thing that I do is if the doctor's having concerns, I will also let the school know. And if they're if they're doing ABA, I know some people have mixed feelings on ABA, but if you feel that ABA is for you and your child is going through ABA, which is analytical behavioral analysis, the one thing I would recommend is also bring a therapist with you to your CSEs, just to make sure that everything that is being done in school is also being done in therapy in terms of disciplinary actions and behavioral intervention. And just making sure that whatever your concerns are, that you jot them down ahead of the meeting, or whatever your concerns are, that you jot them down and let the school know this is what's going on. These are my concerns. Making sure that if they're at risk of running off, that you let the teacher know, you let your CSE know. Stuff like that. I mean, that's what I always do. If my kid's having a bad morning, I immediately text his teacher, like she's real good. I have her cell phone number. I can text her. I'll also text his OT in school saying, hey, he hasn't gotten that much sleep. He's having kind of a bad morning. He might be a little bit, not well behaved, and just also being available for their teachers. I mean, I let them know I work from 8 to sometimes 5 o'clock. I can't always be on my phone at work because I work in a clinic as well. I'm a medical assistant, but they know that if they leave a voicemail or if they call me, I will return their telephone calls, or I'll send them a text message and whatnot. So just also being open for communication. And if you feel that your kid needs OT, physical therapy, ask for the evaluation. That's what I had to do for my youngest. And I noticed that his fine motor skills were delayed, like he would use his whole hand to write. I went ahead and I just asked the therapist in school, I say, is there any way that he can be evaluated for occupational therapy? And did evaluation, and now he has it. So I think it just has to be communication is a big thing within the school district, and just expressing your needs.
Wonderful. Our next question, again, very similar. How would somebody create a positive home and school relationship, that partnership? Again, I'll turn to Kelly and Lisa.
I think creating like a positive relationship is, once again, just keeping the lines of communication open, making sure that you're communicating with the teachers or with the specialists in school as to what kind of things that your kid needs. What are they sensitive to? What are their behavior issues? What are your concerns? And just different stuff like that. And even if you have to give them an email address to communicate, I do that too. Like I'll give them my email address. Hey, here's my email. If you want to email me any kind of activities that we can do at home where I can help prep him and prepare him for school.
Yeah, I would say, especially at the beginning of the school year, it's good to do like a one pager on your child using some of these questions and answers to outline for the teacher. Even when a child has a 504 and IEP, a lot of times the teachers, want to get to know the kids, and they're not necessarily going to get to know them through that 504 IEP. So we do encourage you to do that, a little one pager on my child and what works for them, what doesn't really work for them, and the best way to communicate. Kelly was saying her teacher is very open to sharing her personal cell and texting, but it may be that your child has multiple teachers, and setting up a notebook system and expectations from the school and from you about communication and how often will hopefully make it a better working relationship.
Yeah, I want to add into that communication piece. I think, a lot of times special education teachers, they will have like communication sheets, like homeschool communication sheets that they send home each day with children, just kind of like, here's how my day was, here's some things I did today. But, I always encourage parents, if that's not giving you everything that you want, there might be things that are really important for you to know, like, did they have a bowel movement today? Did they eat their lunch, that aren't on those communication sheets? So, feel free to talk to your teacher and adapt a communication sheet for your child, or make your own and provide it to the teacher. Most teachers are really willing to do that.
And that's another thing I was going to add, Brenna. I know for my child, he's like a picky eater. And that's the one thing that we've been working on, is him eating different foods. And one thing that I did when I first moved up here, because he's had his teacher that he has now for 3 years. I'm like, yay. But the one thing that I had addressed with her his first time being in her class was I had addressed with her his taste texture issues. And I know the one thing that they would do is they would have like the menu. So like I knew each day what he's going to eat. And then even now I know what he's going to eat. Well, pretty much the stuff that he doesn't like pizza. At school, he doesn't like that pizza. So I know every Friday is pizza day. So I know just to pack him extra snacks and stuff like that. Also, I'll let her know what works at home in terms of trying to trick him into reading. Like I was telling her last year when he was doing virtual, I said, well, the one thing that I let him do, I noticed that he shows interest in cooking. So like I tell him, I trick him into sounding out the words of the seasoning to get him to read. And that kind of helped out with like math and stuff like that. I guess they started doing like cooking or like recipe stuff to show him how to add. So just different stuff like that. If you know that that's what works for you at home, bring that in also and discuss it with the teacher in school.
So helpful. Thank you. I know our next slide here, again, some of these that you've already touched on, but any additional tips of working effectively with the school team?
I noticed one of the questions was, if you're homeschooled, do you still have access to these services? So I do want to say that if your child is homeschooled or at a private school, it is the school district that you live in and pay taxes to that's responsible for doing these evaluations. So yes, you do have access. So if you needed a psychoeducational evaluation done, OT, PT, speech, it is that district that you would go to. You need to put it in writing and also sign off permission for them to do it. And one of the things that kind of keeps coming up is, how do I access these services? We have to keep in mind that schools have regulations as well. So you can ask for the evaluations. You should be given the evaluations for your child, but your child also has to reach a standard of before they qualify for the services. So a child may not qualify for occupational therapy through the school district, even though they're having some sensory or fine motor delays. If they don't, please go back to your pediatrician to express your concerns, because sometimes you can get those services through your insurance outside. The other thing, now I lost my train of thought, sorry. There is a good website called starbridgeinc.org. They have lots of great tools for preparing for a CSE meeting, special ed committee meeting. They have sample emails for requesting things like OTPT. And they also have good short articles on your rights having a child with a disability. So sometimes we encourage families to attach those articles to the emails to the special ed committee if they're asking for something that they've asked for before that they didn't get. And a lot of times I saw also one about a high functioning child with an autism diagnosis that doesn't have an IEP. To get a 504 or an IEP, you often have to show how the behavior or the concern you have for your child is getting in the way of their learning or other kids in the classroom learning. So if you can focus kind of on that, sometimes that's a better way to make your case that supports need to be put in place to help your child at school.
I want to add to that too. If your child has a diagnosis of autism and they're doing quite well in school, they don't have to have an IEP or even a 504 plan if they're really doing well. So, those things are really there to support a child who maybe is having challenges or needs that extra support. But even with a diagnosis of autism, you could very well decide with the school team that I don't think he needs an IEP or she needs an IEP. So that's really up to you and the school team to decide. I wanted to add back to one of Lisa's points that she made about, the schools do have to follow their own kind of regulations when determining services for a child. Another thing is, unfortunately, we can give recommendations for these are things that I think could help your child. And we can write those down as providers for you to give to the school, which can certainly sometimes help a parent advocate for their child to get the services that they want. But really, like your provider, your medical provider, they can't dictate at all what's going to happen in school. And, we also have to be mindful that we might be recommending something that just isn't even available at the school or an option. So, keep in mind that sometimes those written recommendations can help you to advocate, but they're not just going to be followed by the school, that it really does still fall on you and the school team to make those decisions.
Great, thank you, everybody. Our next question is for Brenna. There we go. How can clinicians support a family when receiving the diagnosis and starting immediate next steps?
Yeah, so this is kind of a hard question to answer and is multifaceted. So every person is going to have such a unique and personal reaction to receiving the diagnosis. And I also want to say, or not receiving a diagnosis. I find that can be just as frustrating and upsetting to families when you think that your child meets criteria for autism, when other people have said your child meets criteria for autism or might have autism. Or if you're just trying to find an answer because your child is different or having challenges, and then you show up to that appointment and you don't get that diagnosis of autism, that can be a really confusing and upsetting place for a parent to be in. So I also want to say that, that is also a situation where we need to use a lot of empathy and compassion as clinicians. But, in receiving a diagnosis of autism, I think everybody goes into it in a different place. And I think it's really good to assess, especially when you're the person who's evaluating. I like to, before I start the assessment, to figure out where different family members are at with this. You know, what do you think is going to be the outcome of this assessment? What are you hoping for will be the outcome of this assessment? What are you afraid will be the outcome of this assessment? And how are you going to feel about it? I like to just assess that right up front, because then I know when I am about to go and do the feedback, how I can kind of tailor and adapt that feedback according to the anticipated reaction and response that I think the family is going to have, very understandably. So, you know, some people are going to be really understandably upset when they get that diagnosis of autism, and they might not really be in a place at that initial diagnosis to talk about next steps at that point in time. They might just need some time to process that diagnosis and to accept it before I feel like I can start talking to them about, okay, now you need to do this, and then you should do this, and then you should do that. That's just too overwhelming for them. And that's okay to take that time and that space that families need to accept and process that. Other families are like, yep, I knew my kid had autism. Okay, tell me next steps. Where do I go from here? And they're super eager to get some of those next steps for their child. So it really just depends on the family and the individuals present. You know, for families who are ready and eager for those next steps, I think it's really important to, in that visit, really try to prioritize a few of those, help them break it down and write it down with them. I think it's good to do like a max of 3 next steps for them, and, you know, definitely jot it down with them. And then we say use teach back before they leave that appointment. Make sure that they can repeat back to you, okay, so what are you going to do next? What's your next step for it? And make sure that they kind of understand what direction they're going in. In terms of what is the most critical next step after a diagnosis, Val, you flip to this because it's really related to the prior question. You know, that really depends on the values and needs of the family. That next step might look different from person to person. So you can help the family decide what's going to be most important to them. What are they most concerned and eager to get going, and help them follow through with that. Okay, so you really want OPWDD. Okay, so you really want him to get more school support. So let's jot these 3 things down for how you can get there. I would say probably some of the common first steps that I see parents want to initiate have to do with school. And I think we've already talked a lot about school. So they have to do with school or those early intervention services. So a lot of times the first next step might be, okay, you know, share this diagnosis with their school, bring this report to the CSE or CPSE chair, set up a meeting, and let's determine if your child would benefit from additional support in school or an IEP. If you have a young child, it might be, okay, bring this diagnosis, bring this report to your child's early intervention care coordinator to see if they might qualify for more services. Or if they don't have early intervention yet, bring this report to their primary care doctor so you can access those early intervention supports. I would say those are the most common, but certainly that can vary depending on the family's needs.
Thanks so much, Brenna. Our next question is for Lisa. Lisa, what types of services are immediately available to families upon receiving that initial diagnosis?
So there's nothing that you're automatically going to qualify for just because you got the diagnosis of autism, and a lot of the things that you can have access to, you have to apply, it has to be reviewed, it takes some time. So, but for every family, you know, as Brenna was saying, the priorities are different. So we can't answer for everybody, but we can kind of give you some blanket information and some food for thought and prioritize things for your family. OPWDD is Office for People with Developmental Disabilities. It's a New York State program. They have similar programs in other states, and it varies what's included, how easy it is to get the services. In New York State, OPWDD gives you a care coordinator. Similar to when you had early intervention services, you should have a care coordinator. The coordinator can help you figure out for your family and your child what services might be supportive to them. So there's various things based on age and what your child has. Now, an autism diagnosis does not automatically qualify you for OPWDD. We do encourage most families to apply if they want. And then we've talked a lot about what it means for school and what you can get. And again, it doesn't mean that you automatically get any or all of these services, but it is certainly worth having a CSE meeting or CPSE meeting if they're preschool age, to sit down with the special ed team to go over the diagnosis, the recommendations, and have a discussion about any of these services you think could support your child if they're not already getting it. The other thing is trying to connect with other families that have a child with a disability or an autism diagnosis. And, how can you find that out? So a couple New York State agencies, and they're national as well, if there's people attending that are outside of New York State. Parent to Parent is a national organization. The New York website is parent2parentny.org. They will connect you with another family if that's something that you want, but they also run webinars, programs, and what I like most is they also will advertise for other agencies in your area. So if you sign up for their emails, other agencies that are doing things in your area, they'll advertise for. So then you get access to finding out about those activities as well. There is a national organization called Challenger Sports that is specialized for kids with a disability or IDD or autism. So they have tennis, skiing, soccer, basketball, pretty much any sport you can think of. It doesn't mean they have a challenger sport in your area for everything, but I think it's another good organization to try and see if there's something your child might be interested in locally. Autism Speaks is a Monroe County. Autism Speaks is a organization, again, another national one. They have great toolkits for all kinds of things for kids with autism, with visuals and that are very helpful. They also are a good place for resources. They have webinars, so it's a good website to check out as well. And in Monroe County, there's the Golisano Autism Center, Autism Up, Camp Puzzle Piece, and many others. So we always say do internet searches, Google. That's what I do as a social worker if I'm not sure, because we do service families from all over New York State. And Facebook groups, Facebook has done a lot of like closed groups. You might have to ask to be a member, but then once you get added, and a lot of people will put out, my child's really interested in joining a Minecraft group. I live in North Country, New York. Do you know of any programs that are available? And it's amazing how families will help other families to find those connections.
Am I able to add in something?
Absolutely.
So for me, when we were living in Texas, I really didn't know a lot of people that had kids on the spectrum. So the one thing I would do is I would go to Facebook and Google in autism support groups. And I mean, you'd be surprised, like there are a couple of support groups on Facebook. Some of them are not all autism related. Some of them are just related towards if you just have a special needs child in general. And some of the parents in there's a lot of parents that do have kids on a spectrum. And when you're stressed out, that's what I would use just to express myself, is I would just go onto those Facebook pages, and you would be surprised how much support you actually get, and how many other parents would be like, I feel you. And I mean, like, it is good for, especially if you're in an area where you're not around a lot of parents that have kids on the spectrum. Also, I would sit up there, I let my people I work with know, yeah, I have an autistic kid, and you'd be surprised how many of my coworkers also had kids on the spectrum or knew someone that had a kid on the spectrum, where it's like they could kind of understand with what it is that you're going through, and kind of bounce advice off of one another.
I did see a question about OPWDD. If your child has early intervention and is under 3, you can start the OPWDD process, but the service, they wouldn't approve you until you're done with early intervention, because you generally have a care coordinator through early intervention, and families, they don't want families to have two. So, but you can start the process even before 3 if you want to.
Thank you, everybody. And I'll just remind all of our attendees that these links in our list of local agencies here that we've mentioned will be available on the website too. So we encourage you to check them out, but we'll make all these slides and links available to you. Next, I'm going to bounce back to Brenna and ask what about therapies? Kelly had mentioned earlier applied behavior analysis, and what is ABA and what therapies are available for a child with ASD?
Yeah, so you're going to see a couple pages of slides, everybody, with lots of different types of therapies that might be appropriate for an individual with autism. I do want to say that a lot of these therapies, most of these therapies actually can be accessed whether or not you have a diagnosis of autism for your child. So again, you know, a lot of those school supports, you don't necessarily need a diagnosis to access those. If your child is having challenges in those areas, they should be able to access those services with or without a diagnosis. And same for early intervention. I mean, a lot of people start early intervention therapies before their child is diagnosed, and they qualify for them just based off of the delays that your child is exhibiting. But early intervention therapy is, you know, speech therapy, occupational therapy, physical therapy, SEA or special education itinerant teaching services. Those are kind of the main early intervention therapies that exist. For school therapies, this is not an exhaustive list. There's probably more that I could have included on here, don't know about. But again, speech therapy, OT, PT, a lot of schools will have an autism consultant or a behavior consultant, which you could decide should be involved in your child's educational plan. Sometimes schools will offer social skills support to children. This can be really crucial for kids with autism to make sure that if they do have an IEP and they are struggling socially, that there are some social goals on that IEP for their child, and that perhaps they could join something like a social skills group that's being run in school. Of course, if your child needs any behavioral support, you could talk to the school about what options exist for that. Safety supports as well. This was mentioned on our prior slide, but if you have any concerns with dangerous behaviors, especially concerns with elopement or your child running or wandering away from teachers or classrooms, certainly let the school know about this. They can put a formal safety plan in your child's IEP for these behaviors. And then, you know, the other school therapies, just a supportive classroom setting. So deciding what's going to be the most supportive environment, but the least restrictive for your child. Next slide. On top of these early intervention and school therapies, ABA therapy, which I'm going to get a little more into in a little bit, it might be available for your child with a diagnosis of autism. Outside of school, you could also pursue social skills group or social intervention as well. Parent-mediated behavior therapy, that's something that a lot of people will be involved with who have kids with autism or even other neurodevelopmental differences. So that type of therapy is where parents and caregivers work with a therapist on ways that they can help support their child and manage any behavioral difficulties that they're having at home and in the community. Children with autism often have, like Kelly mentioned with her son, feeding difficulties and challenges. So feeding therapy could be something that's appropriate for your child. And then of course, any sort of like individual or mental health therapy, if you're having other like mental health concerns for your child, might also be appropriate. So these aren't things that like, oh, my child's diagnosed with autism, I have to get all of these things. This is just a list of things that you might find could be helpful for your child with autism at some point in their life. And then, as Val mentioned, you know, a question often comes up of what is ABA and how do I get it? And I know Kelly mentioned before too, I know that ABA, people have different opinions on ABA as well for their child. So you might have a lot of questions around that. Is ABA a good thing for my child or not? I have a hard time answering questions around ABA. I'll just say I am a behavior analyst, but I still feel like I struggle when somebody says, what's ABA? I struggle to answer that question. Val, you are smiling there. You might also still struggle to answer that question because it really is kind of this broad umbrella of like just a therapy approach that we use. And there's so many different things you can do within the field of ABA. But it's a therapy approach that we do often use for individuals with autism. The goal of ABA is to teach your child appropriate behavior and new skills and to help decrease inappropriate behaviors that your child might be exhibiting. And ABA skills are broken down for your child and they're taught in small steps to your child. And the idea is that your child learns through consequences for behavior. And so we're trying to teach them with things like rewards and reinforcement for those new skills and appropriate behaviors. Currently, it is our most evidence-based intervention for children with autism. Next slide. However, there is some frustration because we do know that ABA can help, but I think a lot of families have trouble accessing ABA, unfortunately. And this is especially true, unfortunately, in New York State right now, although there are a lot of efforts right now to change this. Right now, currently, your child does need an autism diagnosis to get ABA. So all those other therapies I talked about, your child should be able to get a lot of those without a diagnosis. ABA right now is the one where you do have to have a diagnosis to get it. But I want to reassure you, for those that don't have a diagnosis, this is changing. This is something that is actively being worked on right now and is going to change soon. Also, it's funny because this also just changed. You do have to check with your insurance provider to see if they cover ABA. And unfortunately, some insurance providers will not cover ABA. So that's something that you have to check individually with whoever is providing your insurance to see if they do. I have on here, ABA is not currently covered by Medicaid. This is incorrect. This actually changed as of October. So right now, Medicaid is just starting to cover ABA services. So you see there's still a lot in flux here and a lot of advocating that's been going on to expand ABA services in New York State. There are a few local organizations who I listed who do offer ABA therapy. I don't know where everybody is who's attending this. These are more kind of like Rochester, Finger Lakes, Western New York based programs that I listed on here. So just be aware of that.
Am I able to say something?
Yeah, go for it.
The one thing that I want to say, because when we were doing ABA for my son, we were in Texas. The one thing that I had did was I would go online and research grants. Google is your friend when it comes to grants. Like we were able to get a grant to cover for part of it. Even if the insurance does cover it, there is, just to be prepared, there is like co-payments that you do have to make. So they might cover 90%, but the cost is so much that 90% might still leave you with $5,000 for 1 year of therapy. So what we had did was I would research grants and see what grants are available. There are grants out there that you can get to help pay for ABA. And some of the ABA services, I know we have went through CARD, and CARD had referred us to a grant and told us, well, you can apply for a grant. The other thing is, I know that there's some people that ABA might not be for them. And some people have like worries about ABA. The one thing with my experience that is it kind of did work for my son in certain issues with his language, definitely. His feeding, it worked a little bit, but it definitely worked with his language, with him understanding words and introducing himself. They worked on that introduction because when you would ask him, what's your name? He just would repeat back, what's my name? Or what's your name? But the one thing that they sat down with me and they had asked pretty much, what are the stuff that you want to work with your child? And my thing is that he does STEM, but at the same time, I'm like, I'm cool with STEMing as long as he's not going to hurt himself or hurt someone else, that's fine. But pretty much they usually sit you down and they ask you, what are the things that you want to work on, the behaviors? Mine was pretty much his aggression, his attachment to my husband, because he would just get really attached where if my husband left the house, he would have a complete meltdown. So it is kind of catered to the stuff that you feel that your child needs to work on, but it might not be for everyone, by all means. It might not work for every child, but that was my experience.
Thanks so much, Kelly. Definitely helpful to hear your experience. And I'm excited to learn too about Medicaid covering things by. Next, I'm going to jump over to Lisa and in the theme of services, move over to mental health services. So we had a question submitted about accessing these services and what are the chances of maybe not being put on a wait list, especially 6 months or more. What would you suggest?
Yeah, mental health services to access have become harder, especially during COVID. People's anxiety overall have gone up, and so people are seeking some mental health supports. So here's a couple ideas. Every county has a mental health office. They usually have therapists, psychologists, and psychiatrists if you're looking for med management. There is a shortage of psychiatrists and psych nurse practitioners that can do med management. It's a national issue. So getting on a wait list sometimes for a med person is sometimes easier if you are at a place that has that service and you're doing ongoing therapy at the same center. I would encourage people to talk to their pediatrician. A lot more pediatric offices and family med offices are either embedding mental health services right into the office practice. It may be short term, but it's at least getting you started and they can help you connect with additional ongoing services. Some of the pediatric offices are contracting with mental health services. So that might be another way. If your school is if your child is school age, you could certainly talk to the school counselor or psychologist to see if there's opportunity to have counseling right at school. Many schools have a social worker that's part of their team that is something that they do. It can be written into a 504 IEP if it does get added, so that they make sure and send the child to the counselor for those sessions. A lot of schools also are having contracts and embedding with mental health systems. Genesee Mental Health goes to many schools. That's part of they're embedded inside the school. Psychology Today, we like also because when you go to their website, it says find a therapist and you can put in your zip code. When you push enter, it takes you to a secondary page, and on that page, there's lots of filters. You can filter for autism, ADHD, developmental disabilities. People's faces come up. When you click on the face, it opens their whole profile, where their office is, where they went to school, what kind of therapy they do. And there are a lot of therapists that are not comfortable working with children with a developmental disability. But again, it's a place where you could try and be a good advocate and say, yes, my child is 10, but they function more like a 5-year-old. So if you could treat my child the same way you would treat a 5-year-old, and also maybe talk to them about, this is how my child communicates this is their language level and how they communicate best. Maybe work together with the therapist to see if you can get to a place where they feel comfortable and are capable of working with your child with the disability.
I think too, using like Psychology Today and such to find these providers, I always recommend that families just put themselves on a handful of wait list. You might even get a feel through like the intake process for the therapy office or the therapist. And certainly, you want to make sure you find the right fit of therapist for your child. And so that might mean you go to the first appointment and then you feel like, you know what, this really wasn't a good fit for my child. I don't see them meshing together, but at least you have your name on another wait list. And so you can decline that if you just don't feel like it's going to be a good fit, and wait for the next one and see if you feel like that's going to be a better fit for your child. So it doesn't hurt to put your name on a few different wait lists. And it doesn't hurt to be proactive either. If you're starting to have concerns for your child's mental health, maybe their anxiety or adjustment in different ways, make those phone calls sooner rather than later, even if you're not sure that you want to pursue therapy at that time, because then in 6 months, you'll get that phone call and they'll say, hey, we have a slot for your child. Would you like to come? And either you're going to say, oh, you know what, actually, like, we're doing pretty well. I don't think we need that. And that's not a big deal. Or you're going to say, yeah, actually, that would be really helpful right now. I'm so glad that I made that call, back in May. So just put your name on wait lists.
The other thing is, if you do have OPWDD already, I would encourage you to talk to your care coordinator about maybe helping you find either a therapist or somebody that they could connect you with that could help with whatever the problem or concern that you have for your child while you wait for maybe an ongoing therapist. If they say, I don't really know how to help you, then be a good advocate and ask them if they could talk to their colleagues and their supervisor for some additional ideas. And you may need to put a time frame on them. Like, I hope that to hear from you within 2 weeks about what you found out for me.
And similarly, Lisa, could you speak to a little bit of about financial assistance?
Yeah, so when you talk about financial assistance, I think of like insurance and money that you can access to help your child with a developmental disability. So there are basically two that you could apply for, but there are qualifications. So the first one is SSI, Social Security income. You do need a qualifying diagnosis and a family income below a certain level. So they are gonna, when you apply, they're gonna send you a lot of releases to get information from your pediatrician, any specialist that you're working with. They may actually have you do an appointment with their own specialist to make sure you have a qualifying diagnosis. And then they are gonna ask you a lot of financial questions because your income needs to be at below a certain level in order to qualify. If you do qualify, if your child doesn't already have a Medicaid product, the child would qualify for a Medicaid product. And there is a certain dollar monthly income that the child would get as well. And that is to be used to support their disability. The other one is OPWDD, which we've talked a lot about. The first step is to call and let them know you're interested in applying for OPWDD. Here's the phone numbers for each of the counties in New York State. And they'll send you a packet. Again, a lot of releases to get the information they need to find out if your child qualifies. The other thing that you have to do is go to something called Front Door. That does not help you explain what that is, but it's a slideshow presentation about what OPWDD is and what you could qualify for once you're active and approved by them. Front Door used to be, you had to find a session that met your time, drive there, sit in a classroom or office space. One positive of COVID is it has become virtual. And so you sign up and you go by Zoom to Front Door. Families that have private insurance for their child, they may qualify for something called Medicaid waiver. It's still a Medicaid-based insurance, but since Medicaid is based on income, when you go through OPWDD and Medicaid waiver, they waive the income and you may be able to get the benefit for the child. A child can have insurance through an employer and a Medicaid-based insurance as a secondary. So again, OPWDD, you could get that extra insurance benefit through them. The other thing is they have things called family reimbursement. If you need classes, equipment to support your child's disability, they may be able to find funds to pay for that. A lot of times you need a letter from your pediatrician or a developmental pediatrician supporting that your child would benefit by having the class, the equipment based on their developmental disability. OPWDD also has something called self-direction. Basically, the budget that your child qualifies for, you get to use with the help of a broker and a fiscal intermediary to help you with those. You still need documentation that the things you want to spend the money on will support your child's disability and how it will support them. Kelly, if you want to add anything, please feel free.
I would say for my experience with the SSI, just in case you're still waiting on a medical diagnosis, with my son at the time that we applied for SSI, he only had the speech delay medical diagnosis. He was diagnosed through the school at the same time through autism. With autism, sorry. So when we applied for SSI, they had pretty much referred us to one of their doctors. So like, I think if you have if they have like a speech delay and it's medically diagnosed, I think that they can still probably try to apply for SSI while you're waiting for the autism diagnosis. Because like they'll ask you for any specialist that your child has been to, they'll ask for the name and the phone number and all of that. And we haven't really gotten a chance to use OPWDD yet, but I did do the front door session. I did it through virtual because of COVID happening. We haven't really been able to actually take up classes for him, but I think OPWDD it's awesome. I mean, I have like his care coordinator through Prime Care, and she's great. They're really, really awesome. Any kind of issues that I'm having with him getting like therapy, which I had an issue with because it was such a long wait list, they were able to actually get the stuff ready for him to do Easter seals therapy. So it's awesome if you're able to get it. It really does help out. And I mean, SSI, if you're able to get it, that kind of helps too, because once again, when you have a child that's on a spectrum, it's normal to have one person that's working and one person at home, just because the amount of appointments that they have to go to and stuff. Sometimes it's hard for you to be working and to also make sure that you take them to their appointments.
Thank you both. We do have a few more questions. Our next one, Kelly, perhaps you can start for us. How would you suggest somebody explains a new diagnosis to their child?
I'm just trying to see if it's
Kelly or Brenna. Yeah, feel free.
Yeah.
Anyone. Yeah.
If it's the child that is the one that has autism or the one without.
The one who was just diagnosed recently with autism.
The one who's diagnosed with autism, I try to explain it to my youngest. He's only 8, so I don't know if he really understands it completely. Although I do feel like he knows that he is different, that he learns things differently. He does get frustrated with reading right now. So he's understanding that he's having a harder time than other kids. But the one thing that I tell him is that you do have what's called autism. I let him know that he's no different than from anyone else. Don't let anyone tell you that you can't do something. Try. It might take you a little bit longer, but keep practicing. I tell him, you're a superhero. You have your superpower is autism. You're like an X-Men. If you look at the X-Men cartoons, you have the one character that's in the wheelchair, the other one that has to wear glasses because he has like the special laser vision, and then you have, I think her name was Jubilee, the one that where she touches people, it's kind of like a poison. So that's the way I look at it. Although autism is not a poison, but I mean, like, it's just, I feel like I don't want to. I know he's special needs, but it's like I don't want him to feel that he's any different than from anyone else.
Yeah, and I'll add in, generally, as the slide says, we do recommend that you do share the diagnosis with your child. This is who they are. And, they might have a lot of questions, and they deserve to understand who they are, and to have that time to process that and accept their uniqueness. Like Kelly mentioned, her son, he's struggling with reading right now. And so he notices that he's different from others. And a lot of kids will notice that. And so having that diagnosis can actually be a relief to them that, oh, there's a reason. And I'm not the only one. There's a lot of people who struggle with the same things I struggle with, but also have some of this like unique talents that I do as well. And so, I think a lot of kids and even adults will really start to take pride in their identity as an autistic individual, and that it can provide them with more comfort and support having that diagnosis and knowing that diagnosis. And also it can be really helpful for those individuals to meet and share experiences with other autistic individuals. And this can have a really positive impact. Again, just identifying with other people and knowing that like, oh, I'm not the only one. There's a lot of people who are a lot like me, and we share these differences.
Thank you both. So we've kind of covered a little bit about explaining a diagnosis to the child. How might a family involve, oops, there are some books here too that we'll make available to everybody. But the next question is, how could a family involve the child's siblings? Kelly, we'll start with you.
The one thing that I remember sitting down, my oldest, he's now 12, and telling him about his brother at that time. That was when Franco was 3, so he was about maybe 7. I sat down and I explained to him, your brother has autism. He's going to have some challenges. He sees the world differently, but it's not anything that you can catch. And pretty much I would do stuff like show him slides on YouTube, or also Atypical. Another thing is when we were doing the ABA, we would have to go through parent training classes. I think if I remember correctly, it was every other week we would go to a parent training class in the evening, and I would take him, and the therapist would sit down and talk to him and explain it to like this. There's things that you're born knowing, but there's things that your younger brother isn't born knowing. So we have to teach him those things. So it was just stuff like that. Like, you're born knowing when someone comes in the room to say hi. He doesn't necessarily know that. So we have to teach him that. So I would break stuff down to him. And we also would start watching Atypical on Netflix, which is an awesome show. I'm actually sad that it ended, but that was like a really good show. It had the scenario where the main character is autistic. He has a younger sister that's not autistic. So I think that's a really good show for siblings. So just stuff like that. And once again, definitely having the siblings join therapy sessions, and also have them help out with the exercises that you're working on. If you're trying to work on your child learning how to play ball, let them be the person that is catching the ball and throwing the ball back and forth while you're behind your child, doing the hand motions for them to toss the ball. That kind of really helped us out a lot. And just helping down, like not helping out in the meltdowns, but helping them, like let them help out and talk to the sibling that's on a spectrum. A lot of times my oldest has helped out his younger brother a lot when he's having meltdowns. He'll sit down and he'll talk to him and stuff like that and explain situations or certain things. And now it's like his younger brother looks up to him, and it's like when he sees his older brother doing something, if he's questioning it, if he sees his older brother doing it, he's like, okay, I can do it because my older brother's doing it, now I'm going to do it. Or I'm going to try this food because I see my older brother trying it, so I know it's got to be good and not nasty. So yeah, I think having the siblings help out, it's a great thing, unless, like I said, unless they're having a meltdown and they're getting aggressive, then of course no. But having them help out in the therapy sessions and then the learning and stuff like that, it's really good.
I love that. Thanks, Kelly. What about other family members? Explaining the diagnosis to your family.
The one thing that I would do is I would explain stuff to them and break stuff down, but also I would edit the information that you're telling them. You have certain family members that are judgmental and kind of stuck in their ways, and they might not understand the way that you choose to discipline your child. So I think keeping discussing stuff like their meltdowns, I think it's very important to edit that information, because you might not want unwanted advice, or you might not want them to prejudge your child. And one thing that I learned in therapy, in ABA therapy, is it's not always polite to discuss the behaviors of your child to someone else that might be perceived as, the child might perceive it as it being impolite. Ask them to attend meetings, support group meetings. If you have a support group, an autism support group, ask and see if it's okay for you to bring the family member along if they're showing interest in it. So then that way they can start to understand more about what's going on. Let's see. And also, it's not just that, it will also help them see the stuff that you're going through as a parent, and maybe they'll understand, hey, yeah, that's the reason why you do this and that. And for the education, I would say, like with the teachers, is to explain what might cause a meltdown for your child. And once again, just like explaining their sensitivities. Also with the family, explain what their sensitivities are. If your child has issues with being in a crowded place, I would explain that to the family as well. So then that way, when you're being invited to certain events, they understand the reason why you might not go. Also, explain the routines, like explain, hey, my kid's got to be to bed by a certain time, because I know for me, if my son doesn't get proper sleep, that's when he's not his best the next day. So I know sometimes my family might do stuff late. So I would just explain it to them, hey, we have to go by a set routine, a set time frame. So anything late, we can't really attend. And just also explain sensitivities to them. If they're sensitive to crowds, light, or noise, I would definitely explain that. So in that way, they can be more understanding. Also, YouTube has a lot of very good videos. When my son was first diagnosed with autism, that's the one thing I wanted to know, is what he was experiencing. So I think it was the TMI virtual reality experience through YouTube. I just put in like, what is it like to be autistic kind of like thing on YouTube. And it gives you it allows you to see the world through an autistic child. So, and I think that's very good. It's very educational tool for family members to understand, hey, that's why they act like this sometimes. Or that's why they have meltdowns. So I think it's very important. And how to prepare for family events is once again explaining the sensory issues, the social interactions and expectations and stuff. The one thing I will do is, if we have family members are coming in from out of town where my kid hasn't met them yet, and if they say hi and he's just like kind of like quiet, I said, say hi, say hi. I would cue him and to into saying hi, or if they're asking what is his name, how old he is, I still kind of cue him. You know, how old are you, Franco? Say 8. You're 8, right? Say 8. So just stuff like that. I know my family, a lot of them know that he's on the spectrum, even the ones out of town, because I'll let them know ahead of time. Yeah, he's autistic. Because I feel like I'm not gonna hide his diagnosis, and I'm not gonna let him feel like he should be, you know, shunned for being autistic. No, he's autistic. He's just like anyone else. And pretty much like planning ahead, if you're doing a family outing, making sure that it's in a quiet spot, making sure that's not in an area that's going to be packed, making sure that if you're going to a restaurant, we've done it where I've Googled the restaurant ahead of time, Google the menu to make sure that they're going to have my son's preferred foods. If we're at like a family member's house, I've brought frozen chicken nuggets with me to cook. And hey, can I use your stove for a minute and just, you know, make some chicken nuggets, explain him this is what he eats. He might not eat what you're offering. So is it okay if I do this and that, use your stove? Or I'll cook ahead of time and just bring it along and just heat it up in the microwave. And also just educating the people at the event. He's on a spectrum. He might run off. I have to be with him, you know, completely all the time. So that way they understand, hey, if I walk away from a conversation, it's because I have to keep after my child, because he might run off, or he might do something like a little bit daredevilish, because he is a daredevil. And just making sure that you're also bringing toys and tablets and headphones too, because that's helped us out a lot. If they get bored, just bring a tablet, because if he gets bored, he's going to be walking around. So.
Thanks, Kelly. Definitely that conversation, communication it seems extremely important. I'm going to back up just a few slides just to show quickly a few of these books that might be of interest to participants. I did see a question, you know, asking, are there resources, books that we could use to help explain a new diagnosis to our child or their siblings? So I just wanted to showcase that. Feel free to take a screenshot, but we'll also make it available on the website. Okay. All right, 2 more slide questions, and then we can review some of the Q&A and chat questions coming in too. Kelly, could you explain for us any you know, tips to continue to best support your child with autism that families could take leaving here tonight?
How I best support my child with autism is pretty much open lines of communication with the school, with his doctors. And I cannot emphasize, for me personally, I don't know about everyone else, but for me personally, is seeking that actual medical diagnosis through someone that specializes in autism, because that's when I felt like the doors opened up. For the providers, I would say that if you think that your patient is autistic, depending upon the family, because you don't want to be too pushy, I would just still offer to refer them to a specialist that can actually get them a medical diagnosis. I would say to the family members that are just getting a diagnosis, or to the parents that are just getting a diagnosis of autism for your child, is there are going to be some bad days, but there's going to be a lot of good days. My son is very passionate. He's a very passionate person. He's also very, very silly. So being on a spectrum, it does not mean that you don't have a sense of humor. He's very loving. He loves our dogs. He is always taking care of them, lets them inside, will tell you when they're doing something bad. And like I said, he's very, very passionate and very caring. I used to kind of feel like having an autistic child before he was diagnosed, even when he was a baby, I feel so bad for them. Kind of like I'd be like, is it going to be the end of the world? It's not. It just means that they just have challenges. You have to love them. There's going to be stressful times where you're going to need to go run in the bathroom, pretend that you're using the bathroom, but you're really not for 5 minutes. And that's normal. And I can't emphasize enough how much self-care is very important. If you have anxiety, I think that it's very important for you to take care of yourself in terms of mental health. Because your kids can feel that. They can feel if you're stressed out. You might not be portraying it, but they can feel it. And someone on the spectrum, it's very, very hard for them to actually, for them to actually grasp things, but they can feel your energy. And I feel that when you're being anxious or stressed out or depressed, they feel that, and that kind of affects the way that they behave. So I feel definitely self-help is the best. And for providers, I would say just, being there for the families, understanding that some families might be in denial. They might be kind of like upset, but the upset is not what you think it is. A lot of times it's because, and this is typical, this is what I've run across with my husband, when my son was diagnosed with autism, he was kind of in denial. Now he's not. And now he'll tell you, yeah, my son's autistic. He even wears the shirt, the little autism shirt from Walmart. But he was in denial. But his denial was because he felt that it was his fault. So you have a lot of that going on. So if they're pushing off, pushing back, it could be because of that. Could be cultural too. Autism, it's not anything that they grow out of. It's still going to be there, but I just think that the main thing is support, getting the support that they need, and just being there for them. I try to teach my son independence. And I also wanted to say for the kids that are nonverbal, for just anyone in general in the medical profession, because I've run across this too with certain patients, just because they're nonverbal does not mean that they're not understanding what's going on and that they don't understand language. So, I mean, their value is not less than anyone else's value. So, and I feel that that needs to be addressed, not with the doctors that I work for and stuff like that, but I've seen it where, what do you want to say, medical people that come with them, staff come with them from certain groups' homes, and like I will be talking to a patient. He can't understand you. No, I think he can understand me. That patient can understand. So, and I feel that that is something that I feel that is very important that we as a community need to address with staff members that are helping out, taking care of people with special needs. Just because they cannot talk does not mean that they don't have a voice and that they don't understand what's being done. I'm just trying to read like the other slides. But yeah, I think self-help is very important. And pretty much there are books also on Amazon that you can get to help educate the sibling of autism and stuff like that, or to even educate the child of them being autistic. There's like books that you can get on Amazon that I've done before in the past that I've ordered.
Thank you, Kelly. Wonderful. And I will move forward to our last question. And Lisa, you might start us off, but I love how this is worded. How do I find my village and connect with other families?
Yeah, I always say it takes a village to raise a family. And so this is sort of a list, and we've gone over a lot of these before, of different ways of trying to find your village or your support network. And I realize now the one or two main ones that I left off is your pediatrician. And so if you have a concern about something new going on with your child, or you wonder, children with autism do have comorbid diagnosis of mental health issues. And if you're trying to sort out what exactly might be going on with my child and how do I best support them, your pediatrician is really the best starting place, because hopefully they've known your child for a while and they might be able to help you sort out what's going on. They can rule out any kind of medical thing, because we all, if we're not feeling well, we all kind of are not at our best. So it's always a good place to start. If you already have a developmental pediatrician's office that you're working with, you can always reach out to them for resources, for problem solving. As a social worker, I call myself a professional problem solver, and my role in the office is really to talk with families, find out what's kind of going on and help them problem solve how they can connect with services that they might need to support their child. There's also a lot of case management programs out there that your pediatric office may have access to, like Children's Health Home. They can do a referral, and then you can have a care coordinator, a case manager who can really get to know you and your family, your child, and see if they can suggest some services or supports to help you. So I think there is a lot out there. And if you're still feeling a little lost, we do have, as part of our clinic, but your child does not have to come to our clinic, we have family navigators. They have an email that's right there, familynavigator@urmc.rochester.edu. And if you can send them an email that is a little more specific about what you're hoping to find in your community, they're happy to try and help you find that resource. So that's what they're there for. If you have questions about OPWDD, if you're hitting roadblocks and you don't know what to do next, they also would be happy to help with that. But be patient, because it may take them a little time. If you don't hear from them right away, they may be looking for some resources to answer your question as well.
Lisa, I'll add that you mentioned our family navigators. For all attendees of our conference, if you visit our website, our conference webpage, you are able to sign up for an appointment with one of our family navigators. They have several slots open for tomorrow, Friday the 5th, and Saturday the 6th. So that link is in the chat box, but feel free to make an appointment to chat with one of our family navigators.
One thing I was going to say is I attend the Autism family meetups. I do the virtual one. Those are so awesome. And it makes you feel like you're not by yourself. Like, I mean, we bounce things off of one another. We give each other tips. We discuss stuff. We laugh. I mean, it's Autism Up virtual meetups. I feel like that is just, it's awesome. It's just gives you a time to talk to other parents. And sometimes it's not anything autism related. Sometimes it's just like something else. And sometimes we're cracking jokes. So, and they also offer, like, they also have people that come on, guest speakers, and they'll go over stuff. They'll explain stuff like the processing, like the neurosensory stuff that goes along with autism and stuff like that. They, every now and then they'll do like Autism 101. And even if your kid's been diagnosed for years like mine, sometimes I still go to the Autism 101 workup that they do every year. And that's the one thing I use was Autism Speaks as well for certain things, because I feel that it's legit and it's actual professionals writing articles and stuff like that.
Yeah, and they also have a area where you can post questions if you join their group. And so a lot of times, again, it's parents who have already asked the same question and found the resource. So feel free and use that as a way to connect and get your question maybe answered by somebody who already went through that process. But again, the other bonus of the pandemic is a lot of things have become virtual. So transportation is no longer an issue, and time constraints are much better because a lot of things have gone virtual. So you can join from further away.
And the one thing that I forgot to mention is we actually had an outing with Autism Up a couple months back during the kind of like, I think it was like during the summer, where we all brought our kids at the playground, because they have a playground now. So all the kids got to play with one another and stuff like that. And it was real cool.
Wonderful. Thank you, Kelly. That sounds like a great experience both for the kiddos and for the parents. So that's wonderful to hear. Folks, I'm checking the time. I want to be respectful of everyone's evening. But our last slide here is some additional contact information. Again, that email for our family navigators, as well as contact information for our developmental and behavioral pediatrics division at the University of Rochester. So
the
go ahead, Lisa.
DBP, I just want to add, the DBP website has a lot of other resources and information. So check it out.
And we're very active on Facebook as well. So if you join our Facebook page, you'll see lots of different posts with different opportunities or ways to get involved. So definitely follow us on Facebook.
Thank you both. I do see we did have some specific questions coming in the Q&A specific to people's children. So I would suggest to, if your questions were not answered tonight more broadly as part of the panel, I would encourage you to contact one of our family navigators. They would be happy to help you connect to certain resources and answer some of these questions. I do recognize we had a few in here that weren't answered live. So please feel free to contact us using these emails, check out our resources online. And before we wrap up, I just want to extend a huge thank you to our presenters, Brenna, Kelly, and Lisa, all of our interpreters, and our conference planning committee. So with that, I hope everybody has a wonderful night, and we hope to see you again tomorrow as we kick off our research room at 8 a.m. You can register for that on Zoom and learn about some of our research projects happening. And then we are kicking off our next webinar presentation at 9 a.m. By Dr. Leona Oakes on sexuality and gender identity. So we hope to see you there. I wish everybody a great night, and we'll see you soon.
Thank you, everyone, for joining.
Thank you.
Thank you.
Good night.